Hello, my name is Benjamin Asamoah from MDS Lancet Laboratories, Ghana Limited, and I'm presenting on high resistance to recommended antibiotics for treating urinary tract infections in Ghana. Is it time for a guideline review? Globally, there is an increasing trend in antimicrobial resistance, limiting the options for clinicians in the treatment of urinary tract infections. In Ghana, there is limited amount of data in antimicrobial resistance with uropathogens. In view of this, we undertook a cross-sectional study at the MDS Lancet Laboratories, extracting data from the electronic medical records between the periods of 2017 and 2021, analyzing the proportions of these uropathogens, the antimicrobial resistance, and the factors associated with the isolation of multi-drug resistant isolates. We observed high levels of resistance to all isolated uropathogens, especially to the most common ones, E. coli and Klebsiella, to the most commonly recommended antibiotics in the standard treatment guideline of Ghana. E. coli recording as high as 64%, 62%, and 60% to amoxicillin, ciprofloxacin, and cefuroxime, respectively. Defining multi-drug resistance as resistance to 3 or more classes of antibiotics, 64% of E. coli and 69% of all isolated Klebsiella were multi-drug resistant. Increasing age, residing outside Accra, and the presence of antibiotics in one's urines were also risk factors associated with the isolation of multi-drug resistance. Men also stand higher chances of harboring multi-drug resistant isolates as compared to women. In summary, the high resistance to the standard treatments guidelines recommended antibiotics for treating UTI increases the risk of treatment failure. As such, we recommend the Ghana National Drugs Program should consider reviewing the STG. Research institutions should also investigate other antibiotics to replace those that are gradually losing grounds. Increase in multi-drug resistant risk in men and older patients risk treatment failure. Hospitals should therefore encourage clinicians to request for culture and susceptibility testing before initiating treatment. I would like to thank you very much for your audience, but acknowledge MDS Lancet Laboratories, Salted for the training, WHO and TDR for the funding.